Hello and welcome back. We're going to briefly discuss how to create a plan of care. For our paraprofessional side, you have the ability to create a plan of care so that we can send orders to doctors, obviously for the continued care of the patient. Once you finish your home health care assessment and completed all the fields that are required as discussed in previous tutorials and the education provided to you, we hit the plan of care module. The first thing we need to do is preview the plan of care. We also need to make sure that the date of the plan of care is within the time frame of our assessment and the new certification period. We hit create and we follow through and make sure all the proper fields are where they're supposed to be. We see here that there were changes since the last plan of care. This was done through creating an interim order. Our eligibility, the diagnosis, the medications, DME supplies, everything so far looks great. What we see in activity section is not filled in. All of these fields are required by the Department of Health. Therefore, we need to make sure that we go back into our assessment and complete this. We continue forward. It is perfectly okay that the frequency section is missed unless you choose to fill it in and have been directed to do so, as our frequency is selected here as well. As long as it is covered in our order, we are safe per the Department of Health regulations. Should we be satisfied with this order, we then hit Create Plan of Care. Once the plan of care is created, you then email the administrative assistant directed to you that the plan of care is done and ask them to kindly fax it to the doctor. The other thing we also want to make sure is that after our visit, we have confirmed with the family member that they are still seeing this doctor that is appearing on the plan of care. This is going to be done within our visit and our assessment every time we go, as sometimes patients do change doctors or the physicians retire or several other reasons are possible. They moved, etc., etc. So we will confirm the phone number, the fax number, the NPI, and the doctor that this patient is seeing. We hit create. Again, we notify the appropriate administrative assistant and they will fax it and track it. There also will be a time where the assistant may reach out to you for further information. If after several attempts that physician is not signing orders or refuse to do so, we may need to have you try to reach out to the patient, the family, and even the doctor's office if the office staff is not able to obtain the proper information. That is the completion of the plan of care. So we created it. We're going to go back and check in the chart. And we see here that the plan of care was created. We see our plan of care as we had created it. The last step is we have to open the plan of care. We have to go down to the bottom of the plan of care and we must sign it. So you go back into the plan of care and you see that you have signed it. Your signature will be here, and that will conclude the creation of the plan of care. Any questions, issues, or concerns, please give the office a call. And thank you always for your time, and be safe.